Hello everyone. We're going to talk about the three tooth numbering systems. We have the universal system, the FDI system. FDI stands for the Federation Dentaire Internationals. And we have the Palmer notation tooth numbering system. We're going to start with the universal. The universal tooth numbering system is mostly used in the United States. As far as I've seen, most countries prefer using the FDI system, but from my experience, the universal system, as far as I've seen, is used mostly in the United States of America. So for the universal system, first I'm going to draw the quadrants. Of course, you know that this is the first, second, third, and fourth quadrant. If I have to show it here, I would say first quadrant, second quadrant, this line between the two central incisors being the midline. You have the third quadrant and the fourth quadrant. So let's also write it. One. So in the universal, let's write universal here. Let me erase this. So, in the universal system, initially I'm going to do the permanent dentition, your adult teeth, and then we'll also talk about the primary dentition. So, in the permanent dentition, in the universal system, it starts with 1 on the first quadrant, and it goes to the second, third, and comes all the way to 32 in the fourth quadrant. So 1 being your third molar, 2 being your second molar, and 3 being your first molar, 3, 4 being your second premolar, 5 being your first premolar, 6 being your canine, 7 being your lateral incisor, and 8 being your central incisor. And then it goes on. So 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, and 32. Remember, when we say left and right, we're always talking about the patient's left and right, or ourselves if we're counting ourselves, but never our right and left if we're looking at a person. So this would be the right side, and this would be the left side, right? So this is how the numbering system is in the universal numbering system. And for the primary teeth, let me use a different color. For the primary dentition, it does the same thing, except it does it with alphabets. So A being your second primary molar, B being your first primary molar, C being your canine. Of course, these later become your premolars in the permanent dentition, as in the premolars replace these in the permanent dentition. So A, B, C, D being your lateral incisor, A, B, C, E being your central incisor, and then it goes on. F, G, H, I, J, and then K, L, M, N, O, P, Q, R, S, T. This is how the primary dentition would look. So also good to see how we move from the primary dentition to the mixed dentition, and then to the permanent dentition. Let me erase this. If it helps, I'll still do the right and left, right and left. Until you're 6 years old, your primary teeth are the teeth that are erupting, and then slowly they need to go away, and your permanent dentition your permanent teeth start coming in from the age of 6 years old, and this is the stage where we call it mixed dentition stage. From 6 years old until 12 years old, usually, that's when you have the mixed dentition stage, meaning you have permanent teeth and primary teeth in your oral cavity. After the age of 12 years, you have permanent dentition. So usually when you turn 6, the first teeth that come, I'm not going to be very accurate. I'm just going in general, just so you understand the concept behind it. So usually the first teeth that come or erupt from the permanent teeth would be your first molars. Your first molars would be number 3. It would come right behind your first and second primary molars. And then you have tooth number 14. And you have 15, 16, 17, 19. And you have tooth number 30. These are the first molars. Also, the first permanent teeth that come in to replace, this is also at the age of 6, sometimes between 6 and 7. The teeth that also come in and replace the first primary teeth are your central incisors. So you could say 8 and 9. And right after that, these also change. And tooth number 24 and 25 come in. So as you can see, it's a mixed dentition now. Or it started actually from the time the first molars came. After that, your lateral incisors go, or primary lateral incisors go and get replaced by your permanent lateral incisors. So you get 7, you get 10, you get 23, and you will get 26. By this time you're between the ages of 8 and 9, and then that's when your first primary molar gets replaced by your first premolar, and then your second primary molar gets replaced by your second permanent premolar. Canines usually go last, generally speaking. So these get changed to 5 and 4. The canine goes later, so these two change 12 and 13. And like I said, these are the premolars. These two change 20 and 21, and these two change to 28 and 29. The canines usually are the last, and they start going away basically until you turn to the age of 12. So the premolar stage was somewhere between, being generally speaking, from between 10 to 11, and then the canine gets replaced by the time you're 12. And this is how the tooth number 6 comes, tooth number 11 comes, tooth number 22 comes, and tooth number 27. So by the time you're 12, you have a permanent dentition now. And then by the time you turn 17, your second molars come in. So tooth number 2 comes, tooth number 15 comes, tooth number 18 comes, and tooth number 31. And by the time you turn 21 years old, that's when your third molars come, as we call them, the wisdom teeth. By the time you turn 21, you get tooth number 1, you get tooth number 16, you get tooth number 17, and tooth number 32. And that's how, in the universal numbering system, I showed how your primary dentition moves into the mixed dentition stage and then to the permanent dentition. Now we're going to talk about the FDI numbering system. So in the FDI tooth numbering system, again, this is our right, this is our left. Again, it follows the quadrants. Now the difference between the FDI and the universal is that universal just started from the first quadrant and just moved to the second, moved to the third, moved back to the fourth on the right side, and it just followed a number. Now in the FDI system, every tooth is given two numbers. The first number is the quadrant it's in, the second number is the number that was given to that specific tooth. Meaning, this being in the, let's talk about the central incisor, and everything starts from the midline. So, being in the first quadrant and being the first tooth, the central incisor is tooth number 1, 1. The lateral incisor, being in the first quadrant, is tooth number 1, 2. And then canine is 1, 3, 1, 4 is the premolar, first premolar, 1, 5 is the second premolar, 1, 6 is the first molar, 1, 7 is the second molar, 1, 8 is your third molar or your resident tooth. Same thing on this side, being in the second quadrant, 2, 1. And by the way, we don't call them 11, 12, 13, or 21. We say 1, 2, or this is 2, 1. Because the first number is the quadrant, the second number is the tooth. So make sure you don't call them 21 or 22. Like we would call, for example, tooth number 24 for your lower central incisor. That's not how it would work in the FDI system. So 21, so 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6, 2, 7, 2, 8 being our third molar. And then in the third quadrant we have 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6, 3, 7, and 3, 8. Fourth quadrant we have our 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6, 4, 7, and 4, 8. This is for the permanent dentition. In the primary dentition, they tried to follow the same concept, except just they couldn't call the first quadrant 1 anymore because then it would mix up. So they went with 5, 6, 7, and 8. So in the primary dentition, it's a, let me change the color. So it's a 5, 1, 5, 2, 5, 3 being the canine, 5, 4 central lateral canine, first molar, 5, 5 second molar. Remember, in the primary dentition we only have 5 teeth per quadrant, and in the permanent we have 8 teeth per quadrant. So this would be 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, that's it, 7, 1, 7, 2. Again, we start in the midline and we move towards the posterior. 7, 1, 7, 2, 7, 3, 7, 4, 7, 5, 8, 1, 8, 2, 8, 3, 8, 4, and 8, 5. So this is how our primary dentition would look. And I will also do the same like I did in the universal and show you how we move from the primary dentition to the mixed stage all the way to the permanent dentition. Okay? So let's draw a bigger line. Here. Right and left. Okay. Okay, so again, like we said in the universal system, the first tooth that comes, the first permanent tooth that erupts is your first molar. So 1, 6 comes in, the 2, 6 comes, the 3, 6, and the forceps. Okay? These are the first, I would say, in general speak, I mean, again, I'm not being very accurate in terms of exactly when, but your first molars come in, and like we said earlier, your central incisors get replaced. So 5-1 changes to 1-1, or gets replaced by 1-1. 6-1 gets changed by 2-1. 7-1 gets changed to 3-1, and then 8-1 gets changed to 4-1. Right after that, your lateral incisors go. 5-2 becomes 1-2, 6-2 becomes 2-2, 7-2 becomes 3-2, and 8-2 becomes 4-2. Like we said, canines go last. Your premolars, or your primary molars, get changed to permanent premolars. So 5-4 becomes 1-4, and 5 becomes 1-5. Again, 6-4 becomes 2-4, and 6-5 becomes 2-5. 7-4 becomes 3-4. 7-5 becomes 3-5. Here, 8-4 becomes 4-4, and 8-5 becomes 4-5. We're still at the mixed dentition stage, and we're moving into being 12 years old. Before they turn 12, or by the time they're 12, the canines get replaced as well. So 5-3 became 1-3, 6-3 became 2-3, 7-3 became 3-3, and 8-3 became 4-3. And now they're 12 years old, and they have a permanent dentition, and they finish their mixed dentition stage. Again, by the time they turn 17, 1-7 comes, 2-7, 3-7, and 4-7. And then, by the time they're 21, their wisdom tooth comes, which is their third molars, 1-8, 2-8, 3-8, and 4-8. And this is a fully grown adult permanent dentition. Okay. Now we are going to move to the Palmer notation tooth numbering system. I'm just going to write Palmer here. So in the Palmer, it's mostly used by orthodontists anywhere in the world. So even, like how I said, in the States, mostly the universal is used, but even in the US, orthodontists use the Palmer system. The Palmer system, kind of, in terms of the permanent dentition, let me write right and left. In terms of the permanent dentition, it still follows, it kind of follows the international one, the FDI system. Except instead of numbering the quadrants, like the first quadrant, you know how in the FDI, or you would say the international system, you know how the first quadrant is 1, and then the number given to the tooth, which the central would be a 1, so it would be 1-1. In the Palmer, they draw, or I would say you could draw the quadrant itself. So in the first quadrant, this is how the bracket would look. So they draw the bracket, and they put 1, which is the central incisor. And they would put 2 for the lateral incisor. Draw the bracket and put 3, 4, 5, 6, 7, which is the second molar, and 8 being the third molar. Same thing, except they draw the bracket again. So just follow the line here. So that's how it would look, and that's 1, 2, 3, 4, 5, 6, 7, 8. Again, draw the bracket. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, and 8. In the primary dentition, they use the alphabet and follow the same drawing system, I would say, or the bracket system. So it's A, again, they start at the midline. B, C, D, E. A, B, C, D, E. A, B, C, D, E. A, B, C, D, E. Same concept again. So by the time you're 6, the first molars come in. And then so forth. These get changed to 1s, and then the B's get changed to 2s. What's important is the brackets that tell us the difference. Now, the way they would call it, they would just say upper right 1, upper right 2. Or like if it's a third molar on the upper left, upper right 8. So they would call it like that. Or lower left 3, lower left, or lower right 4, for example. That's how they would call it. But in terms of writing, they draw the bracket and then they write the tooth number or the tooth letter according to if it's permanent or primary. I hope this was helpful, and I hope it helps you recall all 3 tooth numbering systems. Thank you.